So just briefly, this is an initiative launched by the American Board of Internal Medicine Foundation now several years ago, I think, gosh, close to 4 years ago. And really, I think that one of the first organized physician groups coming forward to say, look, we really do need to get in the game around reducing waste, addressing costs, and helping physicians to feel comfortable. Because I think historically, and to a large extent, even still today, if you ask many physicians, and I'm saying physicians, we really mean clinicians more broadly, but this came out of a physician organization, American Board of Internal Medicine, have largely not, and I think polls even today show that many physicians and even clinicians more broadly don't necessarily feel like they have a role in addressing cost and utilization. It feels icky, right? I'm supposed to be helping my patients get the thing that's best for them. The fact that $3 trillion are spent on healthcare and closing on 20% of gross domestic product, that's not my job, right? My job is with my patient. And so I think ABIM very wisely tried to take the perspective of, okay, well, even in your one-to-one interaction with your patient, you really do need to help them make smart choices. You really do need them to understand that more care is not necessarily better care, and that, in fact, there can be a lot of harms and risks associated with unnecessary testing. You guys know all this already, spending more money than anyone else than any other country in terms of our spending on healthcare and not necessarily getting better results. But if you're starting conversations with practices, I'm going over this quickly with you all because you've been involved in this work. I suspect all of you know these numbers. Practices still don't necessarily know these numbers. I can tell you more than once in the past several years, whether in medical home conferences or other learning sessions, when I start with the, why we need to address this, there's a crisis in healthcare, too much spending, not enough quality, I still get hands going up. I still get people, taking me aside afterwards. Yeah, but we've got the best healthcare system in the country. I think it is worth having some of these conversations at the beginning of these efforts with provider groups about why we need a campaign, why we need as a clinical community to address these issues. Go ahead. And then related to the amount of spending, again, emphasizing the statistics, the data that we have about how much of this is spent in a way that could be avoided. So whether that's waste, over-treatment, avoidable utilization, I think, and this is one of the slides from Don Berwick's famous talk now about the 6 sources of waste, right, in U.S. healthcare, leading up to that number of up to 30% of overall healthcare dollars are spent in ways that could probably be better spent. Go ahead. And then I think importantly, again, now translating to the patient communication, right? So again, people don't necessarily, the physicians' patients or clinicians' patients aren't necessarily, again, talking about $3 trillion in spending, 30% waste, 18% GDP, but they do care about their own health, right? So how do we translate that, and how do clinicians translate that message about overall spending to patients? And again, I think choosing wisely has very wisely focused in on issues of safety, and particularly very concrete examples, overuse of antibiotics and what that does in terms of drug-resistant infections, complications, unintended side effects, and the impact that has on individual patients. Another, I think, very sadly dramatic and timely example of that are the unintended consequences, particularly the marked spike in accidental overdose deaths associated with benzodiazepines and opiates. And apparently, if the news reports are true, Prince being potentially the most recent among those, right? But people need to understand that the drugs, medications, tests have unintended consequences, side effects, sometimes even fatal consequences. Go ahead. And then importantly, I think in addition to those risks and health impacts, helping clinicians to understand and to be able to talk with patients about the negative impact of costs. We know now upwards of 25%, I've seen numbers, some even higher than that, in terms of people covered by high deductible plans. The average amount of a deductible is $1,700. Most Americans cannot handle those bills. So really helping people differentiate between high value and low value care, and avoiding getting in a situation of having unpaid medical bills, particularly those that surprise them. So as much as I think sometimes we as physicians have been somewhat reluctant to get in this game, it is absolutely impacting people, and it is impacting their health because they're using deductibles and value-based purchasing, right, as a blunt instrument. As, for people often saying, well, I just can't afford that. So how do we help them make informed and smart decisions about when care is worth it and when it might be avoided? Go ahead. So I think in that context, again, ABIM has very wisely stepped forward and tried to think about, well, how do we do this? Well, we need to think about who are our messengers, our collaborators, and they very wisely went to physician societies themselves. So essentially asked virtually every specialty society now, what are 5 things that you're doing that probably don't have a lot of value, that you do every day that you know probably are not adding value to that patient's care? Importantly, they also knew, well, we're not going to get out to the public just by partnering with physicians, clinician groups, but how do we really find partners in the consumer space? So wisely partnered with Consumer Reports, who have been their major consumer partner, and many others now as well. And then really thinking about how do we communicate, identify our messages, communicate those, and most importantly, I think is still a challenge right now, how do we activate patients, providers, and I would suggest communities around this notion of unnecessary testing?